Welcome to today's presentation, Introduction to Positive Community Norms, the second webinar in the Social Norms webinar series, using the science of the positive to increase your community impact. We would like to note that today's presentation is provided free of charge and is available in the public domain. Also, the information presented today are the views and opinions of Sarah Thompson and do not reflect the official position of HHS or SAMHSA. Please let us know if you have any questions about the information in this disclaimer. It is my pleasure to introduce our presenter today. Sarah Thompson is a senior trainer with the Montana Institute who specializes in training and technical assistance with positive community norms communications. Sarah was introduced to Dr. Jeff Linkenbach's work with the Science of the Positive and Positive Community Norms, PCN, frameworks in 2006. These transformative new approaches challenged her perceptions, reignited her passion for prevention leadership, and renewed her energy for her work. Building on her experience as a strategic marketing consultant serving large and small companies, nonprofit organizations, cooperatives, festivals, and community events, she began working with community coalitions in her home state of Minnesota to prevent underage drinking and other drug use by applying the PCN framework. Through the Montana Institute, she offers consultation, training, tool development, and technical support to communities who are applying the science of the positive process and positive community norms approach to prevention, and is a featured trainer and faculty member of the annual Montana Summer Institute in Big Sky. Sarah is privileged to collaborate with some of the most experienced prevention specialists, innovative thought leaders, and cutting-edge social science researchers in the country. I'll now turn the time over to Sarah.
Awesome. Thank you so much, Taylor. Hello, everyone, and welcome. We are on session 2 of what is a 3-part series. And I want to say first that if you were unable to join Dr. Linkenbach for the very first session, which I guess I've lost track of exactly when that was, but I'm guessing it was a few weeks ago. It's okay. I'm going to do a brief introduction to some of what he talked about, and we're going to dive deeper into what is this positive community norms approach today. As Taylor mentioned, we are coming to you from the Montana Institute, and I actually live in far northern Minnesota, which is Warroad, Minnesota, right at the very tip top of the state. If you're familiar with what the state of Minnesota looks like, there's like a little chimney up at the top that's full of water. That's where I live. I live on an island on Lake of the Woods. So as Taylor mentioned, I'm a marketing consultant. I have my own marketing company, and I have been working with coalitions who mostly are focused on underage substance use. However, I have had the privilege of working with folks who are working on issues such as child maltreatment, traffic safety, even some animal welfare, bullying, mental health, and some of those. So my job as a marketing consultant is sort of boots on the ground work. Like, what is this actual positive community norms framework that Dr. Linkenbach introduced to you a couple of weeks ago? How does that actually translate into work on the ground, right? And so that's what I've been doing on my own, working with communities for the past several years. Through that work, I've been able to become a senior trainer and positive community norms communication specialist for the Montana Institute. I am a student of the science of the positive. So I was a marketing consultant and actually a radio announcer before that. Just a little fun fact about Sarah Thompson. And I was so called to this work as I was introduced to it, much like you're being introduced to it a couple of weeks ago with Dr. Linkenbach and myself, these next 2 sessions. And it has just been an amazing time of discovery and learning for me. So I am into family, food, fun, fitness, and my new puppy, Frankie. Frankie is a year old. This is a shot of the marina on our island here in Lake of the Woods. The work that I bring you today, the information I bring you today is really the amazing research and discovery that Dr. Jeff Linkenbach has done. He is the director and the research scientist for the Montana Institute. He's the founder of this framework that we're talking about. He has over 30 years experience in research and health promotion and is just a wonderful mentor and colleague. Today, we're going to have a quick review of the Science of the Positive framework that Dr. Linkenbach introduced to you last time. And we're going to dive deep into the positive community norms approach for correcting misperceptions and impacting behavior. I have a lot of just really solid examples that I'm going to be sharing with you. We have a little bit of interaction. As some of you saw when you came on the call, there's going to be a poll. So that's what we have in store for us. And we're going to talk about what are some of those very specific things that we can do in our communities. Like, how do we go from theory to practical application? Part of how we do that is through this 7-step Montana model for positive community norms communications. I'm going to introduce that to you today. And also you will have access to, if you don't already, an 8-part video series that will walk you through these 7 steps. And then also we have another session coming up September 20th through this awesome group of folks who are hosting this event. And that one is applying the science of the positive in strategic communications. We're going to talk specifically about the skill of balancing both hope and concern in our communications. So without further ado, let's get after it. The science of the positive framework. What is it? This is what I like to call the textbook definition. If I were to like write this down in a textbook or see it in Webster's dictionary, perhaps this is what it would say. The science of the positive is a study of how positive factors impact culture and experience. Here's what I love about this. I am naturally a pretty positive person, have been my entire life, right? There are some of us who naturally go there. Like we have a positive outlook on things, an optimistic outlook, a very hopeful outlook. And this is certainly that, yet it's also steeped in science. Guys, this is the study. It's not fluffy. It's not Pollyanna. It's the study of how positive factors impact culture and experience. Our focus is on how do we measure the positive so we can grow the positive. And it's based upon this core assumption that you heard a couple weeks ago, that the positive is real. It is worth growing. It's worth growing in ourselves, our families, our workplaces, and our communities. Here's an overview of that science of the positive framework. It's a graphic that in the center has the positive. The positive exists. It is worth growing. Around the outside, we have this cycle of transformation that begins with spirit first, our who, our why, our purpose, the why we care, the who we are. We start there. Then we cycle and go deep into science and take a look at what do we know about what's happening in our community and around our issues. We've moved both our who, our why, and our science into our action steps. And we purposely spend some time in return where we reflect and we rest and we look at qualitative data that helps us with our evaluations of how we're doing, right? There are these 7 core principles that are key and foundational to the science of the positive framework. And they are, we'll talk more about these in a little bit. They are be positive, be present, be perceptive, be purposeful, be perfected, be proactive, be passionate. And there's this space for an 8th P. What does that mean? And it really is a space for you and for me to think, all right, now I'm going to re-energize and move forward in this cycle again. What do I need? What is my sort of mantra or my 8th P as I move forward? There are several steps in which we use to move through the science of the positive framework. So I also want to mention that this is just a framework. And by just, I'm not trying to make it seem less than it is. What I am saying is all frameworks are imperfect. And there are a lot of frameworks out there. You might be working with a SPIF framework, right? Strategic Prevention Framework. You might be familiar with the Communities That Care, CTC framework, right? There are a number of different frameworks, and the Science of the Positive framework is one of those. And I want you to know that if you are moving along and really working with these frameworks, that's okay. We're not saying scrap it all. We are saying that the Science of the Positive framework can help be a guiding framework to lead you through these things. It's a way of thinking. So the cycle of transformation begins with spirit first. And while our spirit, our why, our purpose of why this work is so important to us can come from this really deep place of concern, right? Like, there are tragedies that have happened. There is injustice that is occurring. There are so many things we are so desperately concerned about and want to make change around, right? That oftentimes is our deep why. And we can't just stay there. We need to think about, how do we move forward with hope? Because hope gives us energy. It's a positive energy to move us forward. So we are looking at the science through this lens of what's positive, what's hopeful, what's energy giving. How can we learn? How can we plan? How can we be more effective in our work and our actions? Our actions are based on not just making change while we're funded through a grant or during our time that we're serving with this organization. No, we want to make transformation, and we take some time to rest and reflect and evaluate. So this is the key of the Science of the Positive framework. It is the cycle of transformation that becomes a way of thinking. I use this cycle of transformation to organize this presentation. I start spirit first, then I talk science, then we go into actions, and we spend some time in return. I use this cycle of transformation when I'm putting together an agenda for a meeting. I use the cycle of transformation for putting together an email to go out to people. I want to start spirit first. What's positive, what's hopeful? I want to bring in some science. I want to then go into actions and spend some time in return. This is a way of thinking. I'll never forget it. I wish I had a piece of paper. Well, here we go. I have a piece of paper. There was one time where I was just struggling. I had so much going on. I had to put together a presentation and I could not figure out how to put all of my thoughts together. And I was visiting with Dr. Linkenbach about it. And he said, "Hey, Sarah, take out a piece of paper, write a circle, spirit, science, action, return, and organize your thoughts around that." Guys, this is a way of thinking. And so as we move through the cycle of transformation and our work with the cycle of transformation, it's a daily thing that we can adopt. Lots of us work in public health, right? And so Public Health 101 in its most simple form could be described as reducing risks and increasing protections, right? That's really what we want to do. We want to reduce the risks and all of the harms and all of that. And we want to increase some of those protections. When we're talking about the science of the positive, we're using language around hope and concern, right? Hope and concern. Hope is centered on the positive, that the positive exists, that it is worth growing. What are we looking to increase in our communities? What is it we want to grow? So while many of us are working in the field of prevention, I mentioned to you, like, I work a lot with clients who are working to prevent underage substance use in their community. And we're challenged to think about, what do we want to increase, right? The positive exists and it's worth growing. We know most students are choosing not to use substances underage. That's the positive that exists. We're looking to grow and increase the number of students who are making healthy and safe choices in their communities. We are looking, in some cases, when we're talking about mental health, we're looking to increase the number of people who will step in and help out a friend. We're looking to increase the number of people who understand that if they need help, they can get it. People are open to this, right? We are looking to increase the number of folks who are just really looking to empower other people and focus on their strengths. If we want health, we must promote health. As Dr. Linkenbach was talking about this work, one thing that struck me as a marketing consultant, because before I was doing this work with communities, my marketing business was, working with the sort of private sector and other nonprofits. And this struck me. If we want health, we must promote health. So in prevention, so often we're really focused on harm reduction. And it's crazy important. The science says that it is important, right? To help people understand that the stuff they're doing is harmful to them, right? They need to know that. And yet, if we want health, we must promote health. So like Coca-Cola, when they are talking about their product, it's not often we see them promote Pepsi-Cola, right? Yet in prevention, when we talk about what we want people not to do, our images oftentimes are showing exactly what we don't want people to be doing, right? Guys, don't vape. Vaping products all over the place, right? We talk about mental health and we show somebody in complete despair, like crouched down in a corner. We want to show hope. If we want health, we must promote health. And we are hyper aware that our why is steeped deep in concern. Where there is big concern, there is also a balance of hope. And for those of us that are glass half full kind of people who are looking at the hope and going, yay, most people are not. And we can get hyper focused there too. And we must remember, we have to balance that with the deep concern that exists. And quite honestly, why we're funded. So we look at this skill of balancing hope and concern and knowing that in our communications, we must do that. Our next session is going to be really steeped in learning that. But keep that in mind as we move forward today. We talked about both change and transformation. So we want to make a difference where we are now in our, let's say we're funded for 3 years or funded for 5 years. And we have a time 1 survey and we have a time 2 survey. And we have in our objectives said, we are going to move the dial from, we're going to reduce this by 5% in this 3-year period or whatever it is. That's change, guys. That's great. That's what we're looking for. And don't we also want to leave our place different than when we came? So it is transformed, so it can't go back, right? And how do we do that? We are transformational leaders. Our job is to challenge those core assumptions. And we say, is the positive here in this place? Something that can help us get ourselves in that mindset are the 7 core principles of the science of the positive, which I'll show you in a little bit. You saw a glimpse of them earlier. But these core principles are really meant to shape our experience. Like if we think about the work that we're doing through the lens of the 7 core principles, we're giving ourselves and the others around us an opportunity to see things through a lens that we might not normally have seen. We're training our minds. So we're guiding our actions and we are using these to direct our reflections. So when you think about the science of the positive, spirit first, shape our experience. Science, train our minds. Action, guide our actions. And return, direct our reflections. This is a quote from Dr. Linkenbach's book, Seeds of Fire, Roots of Hope. The journey of 1,000 miles does not begin with the first step, but with orienting oneself in the proper direction. And that's what these 7 core principles can do. This is put together, I'm imagining, Jeff mentioned this to you the last time, if you were fortunate enough to be on that call. But this is years of research that he put together about what are the 7 core principles of the science of the positive. What are the 7 core things that come to mind when we think about the positive? And he put them together in these 7 kind of P words for purposes of teaching. Yeah, this is years of research, so there's more that goes into this, but we want to, as we move forward with our work, we want to be positive, right? We want to look for the things that are positive and hopeful in our environment and really focus our attention there. We want to be present. So we're super focused on data and what's actually happening. We want to be perceptive, be really aware of how other people are viewing what's happening in the environment. We want to be purposeful, like we have a purpose and we are hyper focused on that goal, on that purpose. Yet we want to be perfected. This isn't perfect, guys. This is my favorite principle because I'm a perfectionist by nature, have been for my entire life. And when I really started studying and practicing being perfected, I realized that it was so freeing for me as a perfectionist to realize I don't have to have all the answers. In fact, I don't. My job is to work to be perfected. My job is to dare to improve. So these core principles, so many of the people that work with them have one in particular that they, really connect to. Mine happens to be perfected. We want to be proactive, right? We're super reactive sometimes in our environments, and if we could just get ahead. And so we want to be proactive and we want to use our passion. Each one of you are here for a reason because you're passionate about the work that you do, the impact that you can make. And we want to use that passion. So let's talk about this positive community norms approach. What is PCN, right? The acronym PCN. Positive community norms is simply an application of the science of the positive framework. So I told you a few ways that we can use this framework to move forward. And we can apply this in organizations. We can apply it in systems, communities, cultures, and our goal is to grow positive protective norms. Here are the key steps we use. We look to uncover strengths in our community, spirit first, right? We're uncovering the strengths that already exist there. Our science is focusing on measuring the gaps. So while we're measuring what those strengths are, we're also measuring what's people's perception of those strengths in our community, right? We'll talk more about that in a minute. Then we're going to challenge those misperceptions. Oftentimes we have a norm and then we have a perception of that norm. They don't always match up. So our goal as science of the positive community norms practitioners is to challenge those misperceptions so that we can increase health. Okay, this is a really big slide. There is a lot on here. I'm going to try to walk you through it as simply as possible. So just follow me and hone in on some very specific parts when I mentioned them. This looks a little similar to the science of the positive framework that we pulled up earlier. It was a gray slide and it had spirit, science, action, return around the outside too. Here's what's different about this. So this is a little deeper dive, a little more specificity around what we do. Right there in the center though, we're still focused on the positive. Our goal with positive community norms is to grow the positive norms in our community. Around the outside, we're still working with that framework of the science of the positive, and we're thinking spirit first, then science, then action, and then return. Also along that outside wheel, you're going to see these sort of charcoal gray circles. And those are some key skills that the science of the positive community norms, and the Montana Institute, we train on these skills. So we have reflection, leadership, communication, and integration. In the middle of that, we're still really looking at uncovering strengths and measuring gaps and challenging misperceptions and increasing health, right? And there are several steps that help us get there. We're going to do an activity now. We're going to jump right in. Hopefully you're still with me. And it's a survey. Oh boy, a survey. Don't put it up yet, Taylor. As with any good survey, it's really important that as participants, you know that this survey is completely voluntary. You don't want to participate in this, that's okay. But I'm really interested in your opinion and your thoughts on these things. Just know that there's no way that I can trace your answers back to you. Nobody on this call can trace your answers back to you. And the results are going to be reported in a group statistic fashion. So we're just going to report them aggregately. Nobody's going to know exactly how you answered. So again, this participation in this survey is voluntary. Here's what's going to happen. Taylor is going to put a survey up on the screen. There are 7 questions on the survey, and I just want you to go ahead and scroll through, answer all 7 of those questions at one time. When you're done, you can hit, I think it's submit or done or something at the end of it. I'm not sure what signifies that you're done, but just know there's 7 questions and you'll have to scroll through. Also, I'm hoping that we get a good response rate on this survey. Our goal is like 85% or more of people to participate. So if you're willing, I'm looking for your participation. So if you don't have any questions about the survey, we'll go ahead and roll it. And it should just take you a couple minutes to answer these questions. Go ahead, Taylor.
It's so fun to watch all the answers come in. We're at 53%.
Awesome. I'll give you maybe another minute to complete the survey.
%79. Oh, 80%.
See, we're so close to our goal of 85%. This is exciting. Got about another 15 seconds.
82%. I love the comments in the chat that are happening too. I was flossing right now. Oh, okay, 85%.
This is great. As if on cue, we hit 85% at the timed mark. That's awesome. If you don't mind, Taylor, let's go ahead and look at these. So Taylor's going to pull up the results to this survey. I am going to be walking through the results of the survey one by one and just sort of explaining them. Note, I'm seeing these in real time too. So we're going to be looking at these data together. Go ahead and scroll through on your own as well, but hang with me and we'll talk through some of these things. So when we look at how old we are here on this call, we have a little bit of a bell curve. We're missing some 21 and younger folks, but a good mix and a good representation of age. As Taylor said, we had 85% response rate, so that's pretty good and representative of the folks on this call. While this is a convenient sample survey, right? It's just of people on this call. Well, actually, that's not really true. I was hoping for a census sample. I was hoping everybody would participate on this, but we're close. So let's take a look at the results of the meat of this discussion. Do you know that flossing your teeth daily helps prevent disease? 98% of the people on the call know that flossing their teeth daily helps prevent disease, right? So we have a norm there. 98% of people on this webinar agree that flossing your teeth daily helps prevent disease. Do you think people should floss daily to help prevent disease? How do you feel about this? What's your attitude toward flossing? Your attitude is 93% say, yeah, I think people should, right? 93% think it's a good idea to floss your teeth to prevent disease. Okay, fourth question. Did most people on this call floss their teeth in the last 24 hours? Only 16% said yes. Only 16% said yes. We do have some very solid no's. 53% said, no, I don't think most people did. And there's a good amount of people who just don't know, right? 31%, I'm not sure. How do I know if people flossed their teeth in the last 24 hours, right? So if we were to look at the perception of this, we would actually say, we would keep in mind that yes and the I don't know part. So in the past 24 hours, did you floss your teeth? My goodness, we have a 50-50 split. We do not have a norm here, but we're close, right? And it's a little different than what our perception was, right? So we have 50% of the people who actually did floss their teeth in the past 24 hours, and only 16% of us thought that most did. And so we're awfully close to a most here, but there's definitely a perception gap, right? Like what we thought is different than what's actually happening. So did most people tell the truth on this survey? Most of us, 54%, it's a low norm, but 54% say yes. And did you tell the truth on the survey? 100% of the people said they told the truth on the survey. There's a misperception gap there too. So I am curious. I would love for you to keep this information in mind. This, what we do with the science of the positive and these sort of sessions is I remember sitting in the trainings and going, huh? And we want to spur some of these questions. What does this mean? So I want to ask you in the chat, if you don't mind, what are some things you gather from the results of this survey? What are some things you experienced when taking the survey, when looking at the results of the survey? Janet says that perceptions may not be the norm, right? We don't always do what we know is healthy. Yeah. And gosh, Nancy, people tell the truth. What? People tell the truth? 100% of the people told the truth on the surveys. We know what's healthiest for us, but still we don't do what's best. We know what's right, not always doing the right thing, right? People know better, but they don't do better. It's easy to opt out of best practices. Perception is rarely the norm. These are some good observations, guys. There's always another side of the story. Yeah, we have little faith in each other, Ashley says. Gosh, more people tell the truth than I thought. People doubt others' honesty. Yeah, these are all things. These are all things. Circumstances, no time and false teeth. What did the meme say? Everyone thinks they're honest until the dentist asks about flossing. This is good. So this is obviously a small survey experience meant to kind of highlight some of these very points that you're looking at. There's a large amount of people who took this survey. We found out, gosh, a huge majority understand that flossing is important. They actually think that people should floss. There's a bunch of people who actually do floss. We have a misperception about the number of people who actually do floss. And we have a big misperception about the number of people who are honest, right? And some of us might still be wondering, are people really honest? Did they really tell the truth? Did they actually floss, right? And some of these comments I also loved seeing. Just even this survey, right? Just even this survey is a little bit of an intervention. I saw some people like, I'm going out to buy floss picks tonight, right? Because it makes you think. We're looking at asking key important questions and finding out, helping people explore what that norm is. So thanks for hanging with us on that short little survey. Social norms theory says that we tend to do or believe what we think most people do or believe. And often what we think most other people do is wrong. So some of the messages that might come out of that small survey that we did, if that's what we were looking at, we might say, we couldn't say most people have flossed in the past 24 hours, right? We couldn't say that. But what if we had asked the question, have you flossed in the last week? Would our norm be higher? And what would the perception of that be, right? That might be interesting. I might add that to the next survey. But we could say, most people think it's a good idea to floss, right? This is an injunctive norm. This is what I believe. I think it's a good idea for people to floss, right? To prevent disease. So often what we think most other people are doing is wrong. And norms theory looks like this. So when we are doing a positive community norms communication campaign, using positive community norms as our key approach to our work, we want our science, remember, we're steeped in science. We want our science to be asking two really important types of questions. One of them is we want to know what the norm is, the actual behavior or attitude of the majority of the population, what most people do or believe. So in the example of like underage drinking on a survey, we might ask, how often to high schoolers, how often do you drink alcohol? Now we have a paired question that goes with that on our survey. So we can measure the perception. And we're asking about that perceived behavior. What do you think is the attitude of most people? What do we think most people do or believe? So that type of question, if you look down at the bottom on the right, looks like this. How often do most students in your school drink alcohol? So there's two questions we're asking. I can't stress this enough. It is not very common, unless you are like steeped in positive community norms and you've already made this shift. It is not very common that some of the state or national surveys are already asking that perception of norm question, okay? So if we have opportunity to get in and make some changes or ask some of these questions, that perception of norm question is really important. So how often do you drink alcohol? How often do you think most students in your school drink alcohol? Here's that logic model. We often say with the positive community norms, what's in your green arrow? What are you looking to increase? And that green arrow has this positive arc, right? We're no longer looking at a deficit model. What's bad and how do we, how do we move to improve it? We're looking at what's good and how do we move to grow it, okay? So a norm really is 51% or more, right? That's not a high norm. 51% is not a high norm, but it is still a norm. If 51% or more of the people are doing it, then that's the normal behavior. Some language that indicates there might be some data behind things, and it would be normative data, would be words like majority or most or almost all. They all indicate that this is based on data, right? Here are some actual norms. This is from the 2020 Kansas Communities That Care Student Survey. 65% of Kansas 10th and 12th graders think drinking alcohol is wrong for someone their age to do. 65%. That's the norm. These are 10th and 12th graders, right? 74% of 10th and 12th graders have never used marijuana. Not that they haven't used it in the past 30 days. This is lifetime use. 74% have never used marijuana. 96% of 10th and 12th graders have not used prescription drugs, not prescribed to them by a doctor in the past 30 days, right? These are all norms. We have 65%, 74, 96. And I want to say I've looked at a lot of people's data, their state data, the surveys that they take in their districts and their communities, that sort of thing. When we get our data reports back, is this how it's reported? Not often, right? Our data, when we get our data reports back, it's going to show something like 35%, right? They're going to shift this. They're going to say, oh, we have 26% who have used marijuana, right? Not that that's not concerning. It absolutely is. Even the 4% that have used prescription drugs in the past 30 days, incredibly concerning. And if that's our narrative that we are pulling from, and we're only talking about the non-norm of use, we are missing balancing that concern with hope, right? So here's an example of a community in Massachusetts, Stoughton, Massachusetts. Here are some of their vaping data. So their actual norm was 76% of Stoughton High School students have not used an electronic vaping product in the past 30 days. And this is 2020 data. I should have had that on here. I apologize. 76% have not used an electronic vaping product in the past 30 days. What's the perceived norm? 82% think most students have. 76% have not. 82% think most students have used. What impact does that perception have on behavior? The analysis is clear. So their evaluators took a look at some odds ratios and found this to be a huge risk factor. Stoughton students who believe their peers have vaped in the past 30 days are almost 9 times more likely to vape themselves. So if my perception is, and it kind of makes sense, right? If my perception is that most kids are vaping, if I have the opportunity, I'm more likely to vape because I think that's what kids are doing. That's what everybody's doing. And how are we talking about vaping? I'm not saying that we shouldn't be talking about the harms around vaping. I'm not saying that the number of students who are vaping isn't increasing. And I'm not saying that the vaping companies, the tobacco companies, aren't targeting our youth. These are all huge concerns that I share. Yet if we're constantly saying vaping is increasing, epidemic, all of those types of words, even our own marketing is giving people the impression that most students are doing it, that this is the thing to do, that we don't have any hope. Guys, the reality is 74% haven't. And we can grow that. And if we can correct the misperception, we can correct The 82% that think most students are vaping and we can correct that, that's going to directly impact our behavior. So that's why we go out with messages that simply say the norm. Here's a poster that they put out. I'm just checking, was this, yeah, it was 2020 data. Here's a poster that they put out. In the past 30 days, 76% of Stoughton High School students did not vape. The main purpose of a positive community norms message is to mind that gap. We want to close the gap between the actual norm and the perception of that norm, right? We want more people to accurately perceive that most students or most people are doing the healthy, safe behavior or have and share a healthy, safe attitude. Our goal with the positive community norms message, I'm going to shock you for a minute. I'm going to go back to this. The purpose of this poster is not directly to stop students from vaping. The purpose of this poster is to correct the misperception that most students have about vaping. And when their perceptions are corrected, they are more likely to choose a healthier behavior. If we are unable to correct that misperception, that risk factor still exists, right? So as we correct the misperception, behavior changes. Here's some guidelines of positive community norms message development. So if you're thinking about, or if you already have begun to do some positive community norms work in your community, here are 7 key things that you want to have in your positive community norms message. So as you're developing this, these things got to be there. Number 1, it needs to be positive, right? We just talked about this. Our imaging, our messaging, positive. We are not showing a car crash at prom time to reduce drinking and driving at prom. We're not showing a car crash. We're showing students who are representative of our audience who are making healthy choices, right? Our imaging is positive. Our messages are data-based and source specific. If we don't have data that shows a norm, we cannot say most students do. If we only think most students are making the healthy choice or most people have a positive attitude about this, we can't actually use the term most, or certainly couldn't put a percentage to it, right? We need to cite this survey. It's got to be data-based. So every message that we have needs to have this on there, because what happens? Most people have a misperception about the information we're sharing, and they're going to wonder where we got that information, right? Where did that come from? And we have to be able to provide it. And we need to feel really confident in our surveys, right? So it wasn't a mistake that I let you know the survey was voluntary. It wasn't a mistake that I let you know when you were taking the dental floss survey. It wasn't a mistake that I said, guys, this cannot be tracked back to you. I will have no idea which one of you didn't know it was going to be flossing your teeth, but which one of you flossed and which one hasn't. I don't know who that is. Those types of things are important when we're doing survey administration, because the more people feel self-reported data, the more people feel that their answers can't be tracked back to them, that it is in fact anonymous, the more likely they are to be truthful on a survey. And that is actual, people have done studies on self-reported data, and that is the conclusion. So we need to make sure when we're administering surveys that they're administered in a way that people understand, hey, we're not coming after you for anything. We just really want your honest opinion. Okay, back to this 7 guidelines. Reflective. We want it to be reflective of our area. I live in far northern Minnesota on an island. My community is actually very rural. It's not very likely that I'm going to go ahead and put, big city stuff onto my poster. I want it to be reflective. And by poster, I mean any kind of messaging that we might be doing, right? I want it to be reflective of my audience, of my demographics, of the culture. It needs to be normative. If we don't have a norm on our message, if we're just saying, make healthy choices, if we're not saying most make healthy choices, it's not a norm, right? It's just a positive message. A positive community norms message includes a norm. And so we're looking at our data through this lens. What's normative? What's positive? What can I put on here? It needs to be inclusive. So while there are certainly, in the case of students drinking in a typical week, we've got 83% who don't drink in a typical week. It also means in this case, 17% are, might they feel shamed or excluded from this message? Here's the thing. Our goal through our messaging is not to shame them. Our goal is to help correct their misperception. Students and people who are actually engaging in the very behavior carry the largest misperceptions about what other people are doing, if that makes sense. So in our dental floss, if somebody were going to do some research around our dental floss survey, they might be looking at those of us who never floss. We might carry the largest misperception that nobody flosses ever, right? And that is the research behind those that are participating in like the underage drinking behavior. They carry even bigger misperceptions. And it's even more important that they understand, hey guys, you know what? Most students actually aren't doing this. Like, this is the environment in which you have been exposed to, and there's a lot of us that aren't, okay? We want it to be clear. So not only that you can read it and you can understand it, we want the norm message to be the main message that comes out of our messaging. So there's a lot of stuff we could put on a poster or a video or whatever. When we ask somebody, what's the main message you got from that? We want them to say, most people don't do it. Huh, really? I think everybody lied on that survey. Those are all indications that our norms message is coming in loud and clear. And that's what we want to have happen so we can help correct that misperception. And the last one is, are we neutral? So the message that it's coming from, the people that it's coming from, are we viewed as a neutral party? This is why some people put together a positive community norms campaign brand. It's its own brand that isn't necessarily affiliated with, let's say, public health or a school district or a county or a university. It's got its own brand. So I'll share more about those in a minute. So these are the 7 guidelines for putting together a positive community norms message. There are several types of norms, or 2 types of norms, not several. There's the injunctive norm. That's how most people feel or think about something. So in our case of the dental floss survey, when I said, when we asked the question, do you think people should floss to prevent disease? That was an example of an injunctive norm, right? It is saying, yeah, I think it's important. This is my thought, my attitude towards something. We also asked the descriptive norm. Do you floss, right? Did you floss within the last 24 hours? That was that was getting at a descriptive norm, what you do. Okay, now I'm gonna roll through, sorry, I've got an itch in my nose. I'm gonna roll through lots of examples of positive community norms messaging. And I'm gonna point out some things on each of them that are specific to these 7 guidelines of a positive community norms message. So hang with me. This is an example that you may have seen before. 93% of high school students in Shiprock have never tried meth. And then there's this word, Najoni. Some folks on the call might know what that means, and I may not be pronouncing it correctly. But it is this beautiful word in the Navajo language that means the beauty around us, like see the beauty, look around. The beauty is there, the strengths exist. If there's somebody on the call who has a better definition of what that is, I would really love for you to add it to the chat box and some folks can understand, because this word has such deep meaning. And it's been so beautiful for me to hear from the Navajo folks what this means to them. And this Najone, this shows up on all of their messaging, right? It means something to them. It's a strength. And the message here, 93% of high school students in Shiprock have never tried math. I mean, honestly, if we flip that and we say 7% of students in Shiprock have tried math, whoa, that is a really high percentage. And yet, this is there on purpose because they have measured the perception of that norm. And they know that while 93% have not, there are a lot of students who believe most have, and they need to correct that misperception. Okay, so that's what this is about. This is a great big like wall sticker that went in the locker rooms of Grand Rapids, Minnesota High School. And so let me explain what you're looking at here. On the right side is their positive community norms brand. This is Rapids Rising. So again, it's Grand Rapids, Minnesota. Their PCN campaign brand is Rapids Rising. So that shows up on everything they do. The Thunderhawk is their school mascot, right? And they, of course, have a saying like many schools do, the Thunderhawk way. The school themselves did some research around, do students consider themselves a Thunderhawk, even if they're not in sports and that kind of thing? They found overwhelmingly that students identified as a Thunderhawk. And so we knew, in the sense of being inclusive, that if we included the Thunderhawk in our messaging, that it would be more inclusive. People would feel more like, whether they were in sports or not, that they were talking to them. So here's the normative message that's in the locker rooms. This one is a poster that went up in Alexandria, Minnesota, Alexandria Area High School. Most 67% of students agree that drinking alcohol is never a good thing for teens to do. This is an attitude, right? So this is an example of an injunctive norm. It's also an example of not a very strong norm, right? This is 67%. However, there was significant misperception around this particular question. And so this became really important for the students to kind of help discover that, gosh, most other students are thinking alcohol isn't a good thing for teens to do, right? Here's one. This is an example from a University of Northern Iowa. This isn't a program that I was necessarily part of, but I really like the way that they put this together. 9 out of 10 UNI students have not used prescription stimulants that were not prescribed to them. This is in a college setting, right? Where there seems to be this idea that, you know, for finals week or whatever, you have to be on pills in order to, you know, make it through. In fact, 9 out of 10 haven't used, right? Here's another one from a college campus. This is a community college campus. Their brand, We Are Voyager Strong, again, an injunctive norm. This says most, 87% of new Rainy River Community College students believe it's okay to come to college and choose not to drink. Whoa, there was strong misperception around this, right? So when they asked students, do you think it's okay to come to college and choose not to drink? 87% said, yep, that's okay. And when they said, do you think others think it's okay? A huge majority of them thought, no, I think everybody else thinks you come to college to drink, right? And so this was big to put up during those orientation days, welcoming new students. Guess what, guys? Most of us believe It's okay to come to college and choose not to drink. We're Voyager strong. This one comes out of Washington. As you know, marijuana is legalized. There is a strong perception that everybody's using marijuana. In fact, this is a descriptive norm. 68% of young adults in King County did not use marijuana in the past month. And there's that brand, Most Steer Clear. In this case, that brand is actually kind of normative, right? And it's based on data. The other thing that is really purposeful about this message and so many of the others I've just showed you is that there's not a lot of extra information on here, right? We're just talking about the norm and we're making it front and center. In this case, upper left, big, bright, bold yellow color draws your eye, right? Clear, understandable, eye-catching. This one is from Deer River High School. Most Deer River High School students would rather not drink alcohol when hanging out with friends. This is a community that I specifically worked with here in northern Minnesota. They're right in the heart of the Chippewa National Forest. And so you can see that we've got a forest image here. And the other thing that's important when thinking about putting together your messaging, while we are showing a behavior that is, healthy and normal in, especially in Deer River, lots of students do four-wheeling, there's trails all over the forest. And when we were searching for images, like this is not an actual image of the Chippewa National Forest, this is a stock image. It was really hard to find a stock image that also included a helmet, right? So while we're promoting one health and safety behavior, we want to make sure that we're paying attention to others, right? So our images really matter. Here's another one from Deer River. 99% of Deer River parents don't allow underage drinking. Why do you think we put this up? This is a billboard that went up as you entered both sides of the town. 99% of Deer River parents don't allow underage drinking. There's a huge misperception that the parents are allowing underage drinking parties happening on their property, that they're just taking the keys, right? That is the chatter around Deer River. So when these messages started going up, they started to go, yeah, I don't allow underage drinking, neither do I. And the parent conversation shifted. Here's an example of a poster. This one, this coalition engaged the students, I want to say perhaps in the marketing class, don't quote me on that, but they went in and they taught the students the 7 guidelines of positive community norms messages, and they used their data and showed the students how to look for the norms in the data, and they developed these messages. 84% of Masco High School youth choose not to use marijuana. Here in Little Falls, Minnesota, this is an example of it's a Facebook post. So we know that this coalition's Facebook page largely has the audience of a parent audience, right? And so we use the student data to even help the parents understand. Guess what, guys? Most Little Falls High School students agree drinking alcohol is never a good thing for teens to do. The words that went along with that were very positive, right? Thanks, Little Falls. We believe in the value of our youth. Thanks for your commitment to helping youth stay healthy and safe when it comes to not using alcohol and other drugs, right? So it's a shift in the way that we speak about what's happening in our area. What I love about this one is right down here on the lower left, where they're citing the source. We got the facts from you, okay? So while we're being database and source specific, why not add this? We got the facts from you. This one is a mental health campaign that I've been fortunate enough to be involved in at Oakland University, just out of Detroit, Michigan. They have established a positive norm mascot, which is awesome. Like they actually have a person in a goose suit, and a goose is not their school mascot. But so this guy isn't a mascot, he's actually technically an ambassador. But, he heads out. Well, we'll start to head out again to the community events. And his message is all around their positive normative data that they've collected around mental health. And the university itself does a really extensive survey of their students around mental health. One thing that this organization found, was that the data that they collected didn't necessarily lend itself well to positive community norms messages. There wasn't a lot, like we weren't going to go out and say, most students didn't suffer from depression and anxiety. Like that's not helpful, right? This was all about wanting to reduce some stigma and help people reach out to each other and help normalize the fact that I guess it's okay to not be okay and there are resources for you. And so positive norm, we created a positive norm survey that we added to the Oakland University. They worked with the professors and the research arm of Oakland University to add some questions that lent themselves to this positive community norms message. And so here's an example. The majority, 78% of your fellow students have an increased substance use as a way of dealing with the pandemic. So this was a specific question that was added to the survey during COVID because there was a misperception around, oh my gosh, substance use has gone through the roof, right? Like people are selling out of wine and there isn't any alcohol left in the stores and all of the media was talking about increased substance use. Well, in fact, the majority of your fellow students haven't increased substance use as a way of dealing with the pandemic. And then there was a bunch of other series of kind of mental health. Where can you put these messages? Lots of people think that, they only belong on like campaign materials, right? Like, there's only room for them on a video or, in a TikTok, on a social media post, on a poster, on a billboard, whatever. Well, guess what? This is I told you that I live in a fishing area, right? So this is a little fish hook and dosage is key. We want to get this message out even more than we want to get our brand because we know that our brand can't necessarily impact behavior, but correcting the misperception of norms can. So we put the message on a fish hook and these were handed out at the parades, the local parades. And I mean, super popular. We put messages on t-shirts. We use that same design and we put messages on the glasses that are handed out at the coffee shops for the, iced coffee drinks and the smoothies and that sort of things, right? Doing partners. And why not go big and put the message on a brand new basketball court that's going on in the community? We are community partners. There's people we can partner with that are putting these things out already. Wow, could we put a normative message on there? This is who we are. Most students choose not to drink alcohol. This thing's not going away anytime soon. This is a Chinese character made up of two symbols. One of them is heart and one of them is death. They come together and in the Chinese language form the word busy. Busy. Are we busy in our culture? Isn't it a sign of like pride for us? Like it's a feeling. Busy is not just something we are, it's who we are. When somebody asks, how many times, be honest with yourself, and I'm not doing a poll on it, but how many times has somebody said, hey, how are you doing? And you went, I'm busy. Is that what we see? In the Chinese culture, they recognize busyness is heart death. Busyness can lead to stress, anxiety, right? Exhaustion, heart death. There can be a heart death for our person, ourselves, like I'm so exhausted. And there can also be a heart death of an organization. right? Don't raise your hands if you felt that, but it can happen. And so, are we busy or are we effective? I want to say that the positive community norms approach, science of a positive framework, can help us be more effective, right? Let me show you an example of what happened in Deer River. On the left, so I'm showing you an example of one community. Now, I understand this is one community, but it's a great illustration as to what happens when we do positive community norms messaging and communications over and over and over again. There is a steady drumbeat of normative messaging that goes out in community. Here's what can happen. So on the left, these are the percent of students who believed most of their peers were drinking in the past 30 days. On the right is the actual norm. Okay, it's going to become more clear. So in 2012, this community of Deer River has done positive community norms messaging since 2012. So at the start of their work in 2012, 80% of the students believed most of their peers drank in the past 30 days. In 2012, the actual norm was that 73% had not. 73% of students had not drank in the past 30 days, but 80% thought most had. You following me? What happened after 4 years of doing really solid, 5 years of doing really solid messaging? That perception is being corrected in more and more students. So in 2017, after the steady drumbeat of positive community norms messages, 49% of students thought most of their peers drank in the past 30 days. That's a significant number of students whose perception was corrected. And what happened to the actual norm? Now 86% don't drink in the past 30 days. This continued as more positive community norms messages went out. 38% thought most of their peers drank in the past 30 days, and in fact, 90% have not. If we can correct the misperception, it affects behavior. And there is research study after research study after research study that studies this and shows that type of an effect, right? Correcting our perceptions leads to healthier outcomes. Our perception is everything, and therefore so too are misperceptions. Misperceptions of norms are a hidden risk factor. And guess what? Correct perceptions of norms are a hidden protective factor. So, how do we get there? How do we do this? This is where each of you who have registered for this have received a series of 8 videos. And it's Dr. Linkenbach himself walking you through this 7-step model for positive community norms communications. We believe the solutions are in the community. I'm not handing you ad slicks for you to just plug in your data, right? This is work that you need to do internally. Remember, we're looking at transformation. We're looking at, we are transformational leaders. We want to leave this place different than where it came. And in order to do that, we got to involve community. Here's what happens. We're focusing on communication. Those 7 videos will walk you through these 7 steps. First step, planning and environmental advocacy. We're preparing our environment for the message they're about to receive. Remember, they're used to hearing all the bad stuff. Right now, we're going to start talking about the good stuff. We got to prepare them for that. Step 2, baseline data. It is foundational. Guys, we are looking at our data in a different light. There are not very many data points that come back to us that are showing us the positive norm. And in fact, not that many that are measuring the perception of norm. So we're going to spend time there at our baseline data looking, do we have the foundations we need for positive community norms messaging? There's a way, a system for developing these messages. I just told you some of those 7 steps. There's a communication plan that we can create. There's pilot testing and refining. Let's go out to the community and see what they think of these messages before we actually put them out there, right? There's something that happens in this implementation phase, step 6, that's all about preparing ourselves for the reaction to our campaign, right? Implementation is about hearing and steering the conversation that occurs from these messages. And then there's step 7, evaluation. Our goal is to grow positive norms. Each one of these steps aligns with the 7 core principles. These are the videos that you have access to. I really hope that you stop down and take a look at them. We also have more training available that can walk through each one of those 7 steps. The next time we get together, which is September 20th, we're going to talk about more about strategic communication, specifically balancing hope and concern. How do we balance the hope of the normative message with that deep concern that we have? So we'll do some work on your own, some work through the chat box, but this is kind of a working session. Like, how do I practically put this into application? And we're going to experience some of that the next time. So remember, our core assumption, the positive exists and it's worth growing. If you're looking for more information, I highly encourage you to visit us at montanainstitute.com. And this is the front page of our website right here. You can sign up to receive news and training updates. So if we have more training opportunities, we can alert you to those. And of course, there is a contact link here where you can contact myself or some of the colleagues, Dr. Lincoln Bach, Valerie Roach at the Montana Institute. Whew. Thank you. And now I'm going to turn it back over to Taylor.
Sarah, thank you so much. This has been a great presentation.